Public health, not corporate wealth. Public health, not corporate wealth. Public health, not corporate wealth.
Pills cost pennies. Greed costs lives.
My name is Janice, and I could just say that there's nothing wrong with profit, but when especially Gilead makes so much money that insurance companies, not that I feel sorry for them either, are rejecting people, and literally they're saying, we can't treat you until you're really, really sick. If you had diabetes, you wouldn't wait for the toe to fall off. It's a stigma with Hep C. They can make a lot of money, and that's it. That's what it's all about.
So what's happening here?
Well, there's a big conference with they're sponsoring pharmaceutical companies and health insurance companies. My doctors were great. They fought for 3 times being rejected because being too healthy. They want you to wait till they get sick. And this isn't just with the Hep C drug, the Harvani. There's a new drug coming up for MS. There's all these great drugs. It's not a sustainable system. In other countries, governments can, help negotiate prices. We can't do that in this country. The biggest lobbyists are the pharmaceutical companies in Congress. I want the same health care as our Congress people.
My name is Linda Ray, and I'm a nurse, and I'm really against gouging poor people for drugs. The folks here want to make a buck off of people's misfortune of being sick. And in other countries, many other countries that are more enlightened, they don't allow this. They don't allow people to make mega profits off the suffering of other people, and they have a healthcare system that is more just. So I'm here to let people know that many people in healthcare, including nurses, are really against price gouging and making mega profits off of sick people. And also for people to know the Trans-Pacific Partnership, the TPP, will lock in high prices for people. So we need to be against that as well.
Hep C patients are dying.
My name's Orlando Chavez. I'm from the Oasis Clinic in Oakland, California. I'm the senior Hep C educator there. Right now, Gilead's drugs are costing every man, woman, and child in the United States $91 for this Hep C treatment. A few people are getting treated at these prices, but at these prices, treatment is being denied to many. The price itself has become a barrier, and it is causing Medicaid and Medicare and insurance programs to enact cost avoidance schemes because they can't afford to pay. There's 29 states in the United States that cited Gilead's Hep C drugs as their second most costly expenditure in those states, and yet only 2.3% of the infected population was treated at these prices. Now, no one wants better treatment options than Oasis Clinic patients, but at these prices, we want it for everybody. We don't want to be negotiating separately with Gilead. We think they should sit down and exercise some corporate responsibility and come up with a fair price that works for everybody.
Hep C patients are dying. Gilead profits are rising. Hep C patients are dying.
Which did such a great job in terms of instigating and being a key player in the housing crisis that precipitated the economic crisis 2008-2009, is now sponsoring a conference for investors in pharmaceuticals. It's not enough that Gilead is charging $1,000 a pill. There's a crisis, a health crisis, because pharmaceuticals are skyrocketing. It's astronomical. Working people cannot afford the cost of these drugs. That's why we're out here. And let me say, I'm a retired member of the International Longshore and Warehouse Union. In 1934, here in San Francisco, seamen and longshoremen struck in the midst of the Depression. And when 2 policemen shot 2 of the strikers in the back, it provoked a general strike in all of San Francisco. Everything was shut down except emergency services like ambulances and fire trucks. And that's what made this a union town. That is why today the Westin St. Francis is a union hotel. San Francisco is a union town because of that strike in 1934. The ILWU was a socially conscious union. We integrated our union 30 years before the Civil Rights Bill was passed. We have black, white, Latino, and Asian members to this day. We also saw a broader social concept for unions. We fought to get housing for working class people here in San Francisco. That's why the St. Francis Square housing project was built, because of the ILWU's initiative. And probably most important, as it relates to today, we fought for health care for working people. The ILWU worked with the Kaiser Foundation to try to set up a system where working people could get adequate, affordable health care. And as you see today, looking around here in Union Square, homeless people begging, homeless people who have no place to live, no access to adequate living facilities, and many of them are Hep C victims themselves. That medication needs to be made available to homeless people, to the most vulnerable population, the prisoners. 700,000 prisoners in the United States are infected with Hepatitis-C. They need Harvoni, Sovaldi, the drugs that Gilead has that's making it so high that it's not affordable for these people. So we're demanding decent health care and affordable meds for these people. I'd like to bring forward from the Hep C task force here in San Francisco, Robin Roth. Robin?
Hey, welcome to San Francisco. On behalf of the San Francisco Hepatitis-C Task Force, we welcome you all to share in San Francisco values, which is for public health, not for private wealth. We have a crisis epidemic in this country that's spreading fast. We've got 7 million or more people with Hepatitis-C, way too many of them. The majority don't even know it because of lack of access to testing. And when they find out, it's a cure, they want to be cured. They should be cured. This is the only way to stop an epidemic. This is the first virus that medical science has ever been able to vanquish, and yet we are restricting treatment. We're not curing people who want to be cured, who need to be cured, and people are dying by the tens of thousands every year. And the epidemic continues to spread and affects not only your liver, but all parts of your body and your whole quality of life and productivity of your life. It's outrageous that we have the excessive greed that's raising the price of this treatment. We know that Gilead did not research this treatment. We know that Pharmacet that developed Sovaldi was planning to sell it for $300 a pill at a fine profit, and yet Gilead comes and ups the price over 3 times to $1,000 a pill. Actually, the treatment with Harvoni will cost $94,000, and they're making their profits on our public health care system and on the lives of people. So we need to address this problem. We need to make Gilead make this treatment available at a reasonable profit and make it available for free as they started initially to do for people who have no insurance and who can't afford the treatment. They have gone back on their promises. They've gone back on their promises to Oasis Clinic. They've gone back on their promises to provide the drug for people who need it. At the World Hepatitis Summit last September, we heard about the Hepatitis-C epidemic all around the world. Some countries in the world, most other countries in the world, are able to get this treatment at a cost that won't break their health care system. Yet in this country that is already supported with federal subsidies, research and development that's brought us these incredible cures, and we do thank them for these incredible cures, but they don't do any good in the pharmacies. We need to get them to the people, to all prisoners who have no choice, to all the people. Here at the San Francisco Hep C Task Force, we hear from people all the time. They have Hep C, they're not being able to access treatment. Here comes the truck to the conference. Study after study has shown that it is cost effective to treat people before they have cirrhosis, before their lives and their livers are destroyed by this virus. Are we paying attention to what the studies say? No. Too many insurance companies are keeping hepatitis C treatment restrictions so it does not go to people whose livers can still be saved, but they're waiting until people are too sick. We need to have a concerted effort to make hepatitis C treatment available to all people with hepatitis C. We need more access to testing and screening so we know all the people who have hepatitis C. We don't even know all the numbers. Here in San Francisco, we're going to be holding a San Francisco Hepatitis C Summit to coordinate. We need to all become activists to get treatment for everyone with hepatitis C, whether they be prisoners, people who are injecting drugs, baby boomers who make up 75% of the cases and don't even know about hepatitis C from lack of awareness advertising. This is a big epidemic, but one that we can cure. Eradicate hepatitis C, eliminate hepatitis C as a public health concern, as the World Health Organization has promised. We know how to do it. It's only profit and greed that's keeping us. Today's headline is about people starving to death in a Syrian city. Now think about it. Billions of dollars are being spent by war industry and governments to bomb the people of Syria instead of providing food for starving people. And that is very analogous to what's going on right here. Because we know how to feed people who are starving, and we know how to cure people who have hepatitis C and AIDS and many other diseases. But somehow this obscene conference is going on, and it's all about not how to cure people, not how to distribute these life-saving drugs, but how to make money. This is obscene. We know how to solve these terrible problems that afflict human beings, and we demand that those problems be solved. We know how to do it. It does not involve profit-making. Prison radio has a simple task. We record the voices of prisoners, and they write essays and talk about the important issues in this country, in prison, in war, in all the issues that are important. And the main person who has been recording essays with prison radio is Mumia Abu-Jamal. He has brought the attention of a huge number of people to this issue of not treating prisoners with drugs that we know can cure them, specifically Hepatitis-C. And if we could have heard his message today, he talks about how many prisoners have this disease. He doesn't just talk about himself.
He never does.
Although several months ago, he almost died. He went into diabetic shock, and his numbers for blood sugars were way up in the hundreds. He was seriously in danger of dying. And yet still, the Pennsylvania prison authorities are not providing any treatment to him for this disease that we know how to cure. This conference that we're picketing here today is an obscene reflection of the reality in this country, that the most important thing is money and profit and not human needs. People who are demonstrating here today are showing true care about human needs and true solutions for the crisis in the lack of medical care for curable disease. Thank you for being here. Thank you for speaking out for human beings instead of profit.
Public health, not corporate wealth. Public health, not corporate wealth. Public health, not corporate wealth.
Thank you. The front of your bag should be showing at all times.
Public health, not corporate wealth.
Yeah, my name is Charles Minster, retired trade unionist. I'm here in defense of Mumia and all the Pennsylvania prisoners, the U.S. prisoners who are suffering from Hep C and not getting the treatment they deserve. And for every person out here with Hep C that has to pay exorbitant prices for the medicine that this Gilead is making billions off of.
What do you think about the drug companies and JP Morgan?
JP Morgan's invested.
Well, yeah, you know, capitalism will profit off of the death of their family. If they can make a buck off of it, they're going to make it. And of course, with drug prices in this country not regulated in any way, they'll get as much as they can get.
Brothers and sisters, the first thing I think we need to say whenever we talk about the case of Mumia Abu-Jamal is that this brother is innocent.
Just make sure you stay in front of the speakers.
He was framed up for a crime that he did not commit. That is the murder of a policeman in Philadelphia. The evidence of this, by the way, is if you're interested, all you have to do, there is a video called Long Distance Revolutionary. And on that video is an extra feature, a 15-minute film proving his innocence. We will help you to acquire that if you want to, okay? Now, isolation from society is ostensibly the punishment that one receives when one is convicted of a crime. That's what's supposed to happen. Unfortunately, because most Americans have little concern for prisoners, deranged right-wing elements that run the prisons have decided for some time now that it is their appointed duty to make the prisoners' isolation from society even more miserable, okay? To a large extent, racism is the deciding factor in this paradigm. Therefore, we find prisoners being tortured in a number of ways. For instance, solitary confinement has been determined to be a form of torture. Many of you may be aware that there was a protest started by the prisoners, a hunger strike against solitary confinement. And they were very effective when this became international news. Also, there is the problem of sleep deprivation. In Pelican Bay, today, right now, as I speak, They are waking the prisoners up every half hour. So I want you to think about what is the consequence of this. Obviously, health deterioration, psychological problems. Sleep deprivation is known to be a form of torture. And in fact, for years and years, we have always had authorities that encourage sexual assault between prisoners as a means of social control. And many other subhuman tactics are imposed upon those unfortunate enough to fall within the custody and care of the American prison system. But that's what we're talking about now, custody and care. Mumia is in the custody and care of the Pennsylvania prison system. He has recently, we helped him get to court. He has testified in court about this. And I would like to share a couple of quotes with you later that the judge, to show you how cavalier and flippant the people that run our judicial system are. But let us continue. To this, we now add the forms of torture that prisoners are subjected to. Okay. Medical neglect as a concrete tactic to torture and finally kill American prisoners. Unfortunately, Mumia is not the only one subjected to this madness. There are 10,000 prisoners in the Pennsylvania prison system that have hepatitis C. So this is not just a Mumia. To his honor, Mumia has raised this in court and called for the treatment of all prisoners in Pennsylvania that have this horrid disease. Now, also right here in California, Mario Martinez died recently, well, last year, of a preventable disease, that is asthma, in Santa Rita jail, despite the fact that his family had acquired not one, not only one, not only two, but 3 court orders that he be treated for his illness. He collapsed and died in the prison yard. Medical neglect kills. We know this. Excuse me. Okay. Oh boy. I would just say that the Labor Action Committee to Free Mumia has worked uninterruptedly for his freedom since the 1990s. From our perspective, and this is what's important, there is a solution to all of this. The American working class, despite its pimps, its pimples and warts, is the only historically progressive and creative social class that can bring an end to this suffering. It will soon come, and we believe that, in fact, with your help, Mumia will be treated. Thank you very much.
Gilead profits are rising. Hepatitis-C patients are dying. Gilead profits are rising. Hepatitis-C patients are dying. Gilead patients are rising. All right, forefront. Health care for people.
We're here to well, this is a protest. We're a coalition of community organizers, and we're here to let investors and big pharma and the biotech industry know that we're no longer going to accept these outrageous pharmaceutical profits. We're specifically focusing on the worst offender, which is Gilead. They were the recent subject of a Senate Finance Committee investigation that showed they put profits over patient outcomes, and they're bankrupting our healthcare system with their $1,000 a day hepatitis-C treatment. They probably are. They probably are. And it's time for some corporate responsibility. We don't have a problem with corporate profits. profits, but we do have a problem with profiteering. And what bothers me is that if the corporations don't reel in their worst interests, then what's going to happen is we're going to have a president that's going to regulate them, and we'll see squelching of innovation.
Does it bother you as a doctor that you can't treat patients?
Of course it does. Of course it does. I spend more time now filling out paperwork and trying to access medications than actually treating patients, and that's crazy.
So you're
Just
prevented from
crazy.
doing your work as a doctor?
I am, simply because
What's
it's
wrong with the system?
we're too focused on profits. Profit is good, profiteering is bad.
Alex, we're protesting the curtailment of the needy program that they used to have to help needy patients. They have programs if you can't afford it or if you don't have medical insurance, and they curtailed it back in July. And we're just protesting their doing that when they're making billions of dollars worth of profit. We don't feel that it's a great drug that they have, and we don't mind them having reasonable profits. But when they're cutting back on programs that help the people that need it the most and also to spread the disease, we're protesting against that.
And are people dying because they can't get the drugs?
Absolutely, absolutely. I don't have any specific examples, but I know, if somebody is rejected and doesn't get treatment that he needs, it's a drug that it's a disease that will kill you, and
So it's a death sentence?
it's basically a death sentence if they don't get treatment, especially when you get into the late stages. And you have liver failure and all kinds of problems like that, and they need the drugs to survive.
So what are you asking for?
We're asking for them to not curtail the program that they used to have, that they put in some very heavy-duty restrictions on the program that they used to have to help people that were needy. And so it's restricted the ability of clinics to help people that they help for low income, habitual drug users and the like. So that's what we're looking for.
Why? Because they cannot afford health care. Does that mean anything to the investors inside here? Nothing at all to them. All they care about is how they can make greater and greater and greater profits from something that should be a right for every person. Healthcare should be a right for every person. And that includes people who are in prison. And that includes Mumia Abu-Jamal,
Right.
who is a heroic figure, who has suffered at the hands of the state, who has stood up through all these years, and who has been denied the treatment that could cure him of Hepatitis-C, like it is now curing so many other people. Why can Gilead Science, why can they can just say, we're going to raise the price of this pill from $10 to $1,000 a pill. Or they can say, we're going to raise it to $1 million a pill. Why can they do that? Why are they allowed to do that? Because of the system we live under. Under the capitalist system, capital reigns. The capitalists can do whatever they want with the resources of society. Did Gilead Science by itself produce this drug? No, of course not. It's based on hundreds and thousands of years of human development, of science. But because of the system we live under that's called capitalism, they can decide to raise the price of a life-saving medicine from $10 a pill to $1,000 a pill, or whatever they want.
Okay.
And that's why we need a new system. We need a different system. And the different system we need is called socialism. It's the only alternative to capitalism. There are no others. And we need to free all political prisoners in this country. We need to replace the prisons with schools, with universities. This needs to be available to everybody. We want freedom for Mumia Abu-Jamal. We want freedom for Leonard Peltier. involved here. Both of them are suffering from medical neglect as well as everything else in prison. They must be freed. Health care for people, not for profit. Health care for people.
Big Pharma is getting a lot of bad publicity these days. A lot of bad publicity. For the likes of people like Martin Shkreli, who was recently imprisoned. He bought a pharmaceutical company, Touring, and jacked up the prices of life-saving meds unconscionably high so that people could not afford it. That's called profiteering. And he was arrested and sent to prison. But he was sent to prison for security fraud, not for profiteering. And that's because in capitalist America, profiteering is not a crime. It should be, but it's not a crime. And so, you know, the Better Business Bureau or the Chamber of Commerce for the pharmaceutical industry is called the Pharmaceutical Research and Manufacturers of America, PhRMA. They even admit that there's a problem with the pricing in pharmaceuticals, but they blame it on hedge fund entrepreneurs like Martin Shkreli, and that's a lie. The profiteering is being done not only by Touring Pharmaceuticals, but by even the major pharmaceuticals like Pfizer, like Gilead, who's here today, like Eli Lilly. It's across the board. It's not just these entrepreneurs like Martin Shkreli, who PhRMA is trying to say that these are just hedge funds masquerading as pharmaceutical companies. BS. It's the entire pharmaceutical industry that needs to be brought under control. We need price controls on life-saving meds. And that's exactly what Big Pharma fears. And that's why they're trying to scapegoat people like Martin Shkreli, who should be in jail, but not so much for security fraud, but because of profiteering. People are dying while Gilead's profits are rising. And they're connected. And it's got to stop.
Very good point.
Now, people need to know that Gilead's cure for hepatitis costs $1,000 a pill. That's right, $1,000 a pill. And for a full treatment of 3 months, that's nearly $100,000. That's unconscionable. There are 3 million people in the United States infected with hepatitis-C. There are 170 million worldwide. And there are 700,000 prisoners, the most vulnerable people in our society, who are infected with hepatitis-C and need this medication now, right now. Today, in Scranton, Pennsylvania, there's a trial going on, the trial of Mumia Abu-Jamal, which will be precedent-setting for prisoners to be able to have access, free medication for Hep C for prisoners, 700,000 of them. And we need to make sure that happens. So we need to stop the profiteering. We need government price controls and lift the constrictions on generic meds. Universal health care and Medicare for all will provide that.
Pills cost pennies. Greed costs lives. Pills cost pennies.
Greed costs lives. Pills cost pennies. Greed costs lives. Pills cost pennies. Greed costs lives.